where I work, very similar to this place. Work at Loyola Medical Center. It's just west of Chicago, and the big medical center like we're at right now. So I have the privilege of working with a big team of physicians and nurses and staff that take great care of patients. I also get to work with dental residents. So I'm very lucky, very lucky to get to work in a really cool place, which is the hospital, and I get to work with dental residents. So Sister Jean, if anybody knows Sister Jean, so she got a little bit of ink and a little bit of fame last year during the Final Four. So Loyola made a little bit of a Cinderella run, the Final Four, and Sister Jean was the inspiration for the team. So on a side note, in the dental clinic, we get to make the mouth guards for the basketball teams. So we were definitely rooting for them. So anyways, that's where I work and what I do. No disclosure, so I will show some products later on and throughout, but I do not work for any of these companies. I don't have any interest in these companies, just to say that ahead of time, to get it out there. So anything that I show you related to products or little tips and tricks and things like that are strictly because it's what I think works, or I hope works, or patients have told me works or helps them. Okay, so I'm just passing it along. So any of the names that I mention on products is strictly because I think that they're good things. Okay? So what we will do, excuse me, my throat, I'm sorry.
Okay.
We will talk about the oral findings, what your dentist can do to help you, what you can do to help your dentist, a few tips and tricks, and some questions. Okay? So I'm going to breeze through this because there are some people in the room a lot smarter than me that will talk about it in detail. But the reason for keeping these slides in here, as everybody in the room knows, or most people in the room know, scleroderma involves so many different organ systems. Okay, so my talk obviously is going to be focused on kind of the neck up, oral cavity more specifically. But as we know, so many different things that it affects. So vascular issues, pulmonary, like Dr. Ward talked about, cardiac, a lot of things that we need to be aware of. Renal issues, which we'll talk about in the afternoon. A lot of patients have rheumatologists on their team. Some GI issues, endocrine, neurological. Okay, so those are not my areas of expertise, although I need to be very aware of those for different circumstances when treating patients. Okay, so for example, if a patient has some severe cardiac issues and we need to give you some local anesthetic or numb up an area, or do something under IV sedation, we need to be aware if you have any cardiac issues. Same thing with pulmonary. If you are on oxygen, or we need to give you oxygen or nitrous, things like that. Myself and my dental team need to be aware of that and up to speed. Okay, so although I'm not a specialist in any of these areas, I need to be up to date on the big things. Okay. I apologize for putting this gentleman on screen. I'll try and make up for it on my next slide here. So the reason he's up here, it's a team effort. Okay, so your team should or does or will involve a lot of different specialists and a lot of different providers. Okay, so everyone needs to communicate and be on the same page. You might have a rheumatologist, cardiologist, pulmonologist, physical therapist, nutritionist, dentist, all these different things. So everybody will be working hard and together, hopefully, for the only goal is to help you. Okay, so you're the quarterback. You're the Tom Brady. The reason I put Brady on here, he is known for, first of all, playing at a high level at an older age. He's not old, but he's obsessed with details. Okay, and he's very, very demanding. And I think that people as patients need to be very demanding and obsessed with details to give yourself the best care. Okay, so that's why Brady's up here. I'm a big fan of his. He went to Michigan, like the University of Michigan, and I like people that always want to try and get better. So he's known as being obsessed with getting better, attention to detail, and everybody as a patient needs to do that. So if someone's not pulling their weight on your medical team, you need to find somebody new. That's my opinion. Okay. I'll make up for it here. I am actually a Broncos fan. My brother lives here in Denver, so I get out here often. I do like the Broncos. They got a tough game today. There's a picture of my wife and I. We did a little whitewater rafting thing. I'm all twisted around my geography, but it wasn't too far from here. So not this past summer, but the summer before. So again, I love getting out here and smelling the fresh air, even though it makes my throat dry. Things we have 7 main points that we'll talk about. 2 of them are things that you will find on X-ray. Okay, so there's really nothing you might not even know about it, but the reason I bring it up is if you have X-rays done at your dental office, your dentist might point it out to you, so it's more of an FYI. So the 5 big things that we'll talk about: dysphagia, limited mouth openings, xerostomia or dry mouth, increased risk of periodontal disease, which is gum disease, and decay, cavities, and GERD. Okay, so those will be kind of the 5 key things, and then we'll talk about the 2 radiographic findings as well. All right, dysphagia, fancy word for difficulty swallowing, okay, and can be caused by a couple different things. One thing, atrophy of the muscles of the esophagus, and so if you think back to the old, we did it in elementary school, the science test to show how food moves down your system. We had like a nylon or a pantyhose, and we put a tennis ball in there and you squeeze it and watch the tennis ball go down to the end of the tube. That's how the muscles of your GI system work. And if those muscles are not functioning at their full capacity, you can have trouble moving food down the system. As a lot of people probably know, patients will tell me as well, difficulty swallowing secondary to dry mouth. Okay, so kind of 2 different branches related to the difficulty swallowing. 1, because of the muscles, they can't squeeze and push the food down. 2, because of the dry mouth, food sticks to your cheeks and your teeth, and your throat's really dry. Okay, so it's hard to get the food down. So kind of 2 different things, but we'll monitor that. I will try and learn more about it to find out on your patient interview maybe which one you're having trouble with to try and help you better. Okay. Other thing, limited mouth opening. Dr. Moore talked a little bit this morning about the collagen deposition in tissues and things like that. Happens all over the body. Also happens near the mouth and the oral cavity. Okay, so big problem, potential problem or challenge for myself or your dentist when we're trying to treat you. The oral cavity, to start with, is a pretty small place. So we need to be able to get in there with our big hands and our instruments and our drills and our different tools that we use. So it's already sometimes difficult and challenging. So you can imagine that would be increased if patients can't open as much because of collagen deposition. The tissue can't be stretched. Okay, so if you picture tissue normally being nice and elastic and stretchy, all of a sudden it turns more fibrous, almost more like leather. So instead of being like an elastic, it's more like leather. So very tough to open and move. So that makes for a challenge. So one thing that I always do with every single patient, regardless of your age or your health conditions, take measurements of your maximum opening. Okay, so I always want to find out how big you can open. The quick thing for myself, if we're seeing a patient in the hospital, instead of in the dental chair, and we might go up there just with a flashlight and popsicle stick to take a quick peek around the mouth. For myself, the quick, easy test is to have a patient open as big as they can, and normal opening on a patient is about 35 to 40 millimeters, and for me that's like 3 fingers. Okay, so I'll have gloves on and say open as big as you can, and I go like that. Okay, if I can get my 3 fingers in there, I know there's somewhere around 35, 40 millimeters, and that's pretty good. Okay, so if I say open as big as you can, and I can only get 1 finger in, and they can't stretch any bigger than that, then that will be a challenge. Okay, so I always take measurements, and on follow-up appointments, we always measure their maximum opening to see if that number's staying the same, or maybe even getting bigger, which is great. You just don't want to see it go the other way and go down. Okay, so this picture here is just to demonstrate again kind of the fibrosis of the tissue. Kind of the best picture I could find of a patient of mine. And you can see, I hope, kind of that fibrosis of the tissue. So this patient here, don't mind the extremely white teeth, they're fake. So those are not real teeth, but they jump out, they stand out way too much, but that's what the patient wanted, so we ended up doing that. But again, as you can imagine, this individual has a denture, okay, so a full plate on the top, and given her inability to open real big, it was a challenge to make that denture. Okay, so not saying it's impossible, but just a challenge, which I think is a good thing because we were able to do it, and it was a lot of fun, and she can now eat food. So xerostomia. I'm going to try not to get off topic here. I could talk about dry mouth and saliva for days and days and days. I think it's so important. I'm very passionate about it, which sounds really weird to be passionate about spit and saliva, but it's such an important thing. So I will try and stay on topic. So xerostomia, fancy word for dry mouth, can be caused by a couple different things. Okay, one is medications. Okay, dry mouth can be secondary to medications that patients take. There's a whole slew of medications for different conditions that can lead to dry mouth. Okay, it can also be caused by destruction of the salivary glands. So your salivary glands in your mouth are not producing enough or any saliva. Okay, so kind of two different things again. And dry mouth can cause a lot of things. Okay, so it makes your ability to chew, eat, speak difficult, which can affect your quality of life in a big way. Okay, so that's one side of it. The other side of it, from a more of a dental standpoint, is it can lead to increased risk of gum disease, fungal infections, and cavities. Okay, so your saliva does so many amazing things. I'll get off track a little bit here, but your saliva's job, so saliva spit, your saliva's job is to, first of all, wash away food after you eat. Okay, so if you're snacking on pretzels and you have pretzels stuck between your teeth, usually after you eat pretzels or popcorn, you're sitting there picking them out, right? Or how you doing is you're picking things out between your teeth and things like that. Your saliva helps wash those away, so it's kind of like a car wash. Okay, over time, you don't even notice that you're doing it, but your body's producing saliva. Over the next 10 or 15 minutes or half an hour after you eat any meal or you drink anything, your saliva is washing off your teeth and surfaces of your oral cavity. Okay, so if you do not produce enough saliva or no saliva, things will stick around, and when things stick around in between your teeth and on your teeth, it can lead to cavities. Okay, so that's one thing that's not great. Another thing is fungal infections, bacterial infections in the mouth. So what your saliva does is it helps regulate that normal flora. Okay, so you'll hear that word sometimes. Normal flora is kind of the good mix of bacteria in your mouth and in your GI system and in your gut. It's all over the place, but it's in your oral cavity as well. Okay, so if your saliva, you don't have enough or you don't have any, and it's not able to regulate, then sometimes the bad stuff starts to win out, and you can develop fungal infections, bacterial infections, things like that. Most or all of those things we can treat, sometimes with a topical cream if it's on the outside of your mouth or on your lips. Sometimes it's in the form of a mouthwash, things like that. But a lot of times those things develop because of lack of saliva. Okay? Related to cavities, again, going back to regulation, your saliva keeps the pH in your mouth at a good normal level. Okay, so pH is on a scale 0 to 12. 0 is very acidic, 12 is very basic, and your saliva, just knocked that out, sorry. Your saliva is right in the middle, about 6 or 7. Okay, that's normal. So when you drink something like orange juice, you have something containing vinegar, tomato juice, things that are very acidic, lemons, lemonade, it turns everything in your mouth more to that acidic range. Okay, so your saliva kicks up, works up very hard over the next 15 to 25 minutes to regulate it and bring it back to that normal area. So if you don't have enough saliva or you don't have any saliva, you tend to live or be more your normal range is more in the acidic range, and having acid on the teeth leads to cavities. Okay, so a few things related to saliva and spit. I didn't really include my little side notes there on the presentation, but those are kind of the three big things about saliva. We could talk about all day, but we don't want to do that. Okay. Excuse me for 1 second. Things we can do to help you. So we have substitutes, okay, sprays, gels, rinses, Biotine products. A lot of times you'll see that on the shelf in the pharmacy or the grocery store. Biotine has a line of their products that they really focus on dry mouth, and they do a really good job of that. Okay, water, very good for dry mouth, as I'm proving to you guys. And sugar-free drinks, gums, lozenges, and I'll show some pictures in a minute that I literally took as I'm a dental nerd, obviously, and so when I walk through grocery stores or farms, CVS or Walgreens, I don't know if you guys have those out here. I always go to the oral health section. I just take pictures and I look at products. So that's my dorky little thing, but I always want to see what's available so I can tell patients, right? I don't want to tell you, oh, you can go to CVS and get this over the counter, and then they don't have it, right? So I do it all the time. So we'll get into some of those. We can also prescribe you medications, okay, that can help kind of stimulate your saliva. There's a few contraindications that we need to be aware of, but we do have medications we can give you as well, okay? Cafesol is one that has come out. Honestly, I do not use it very often. I don't give it to patients very often, not for any reason in particular, but everybody has their things that they like and that they think work, and you tend to stick with those things. Okay, so Cafesol for myself personally is not one, but a lot of friends and colleagues use it, and they swear by it. Okay, so you do need a prescription. It's almost like a gel or a rinse that you swish around. It's very good. Okay, like I mentioned, Biotine products. There's a ton of them that are very, very good for dry mouth. All of them over the counter. Okay, so you don't need a prescription for it. You can try different things. They're not overly expensive, and so very, very good products that Biotine puts out. Okay, here's my little iPhone camera pictures for you guys that you can see. All right, so like I said, I do not care about any of these companies. I'm not pushing any of these companies just so that people know, but they're things that work. Okay, so on my shelf in my house, I have a bunch of different mouthwashes that I just try to see how they feel and see if they work. And Biotine, I don't use Biotine, but they have very, very good products. Okay, ACT is another very good one. Okay, again, they have kind of a dry mouth line that they focus on, and this is my favorite picture, other than pictures of my family. And so this slide has like my 3 favorite bottles of mouthwash, and it has ACT right here, and it has Crest Pro Health. Okay, so things to look for. Take-home message of this slide: things to look for in a mouthwash if you have dry mouth: no alcohol and high fluoride. Okay, so those are the 2 things that you want in a mouthwash anytime, but especially if you have dry mouth. Okay, so alcohol in a mouthwash, things like Listerine and Scope, when you swish and you spit it out, you get that burning feeling, right? My mouth feels so clean, it feels awesome, I get that burning feeling. That's from the alcohol. Okay, so that's not a bad thing, but if you have dry mouth, alcohol will dry up your tissue even more. Okay, so you want to avoid alcohol, and fluoride. Anything with high fluoride helps fight cavities. Okay, so ACT and Crest Pro Health are no alcohol and high fluoride. Okay, Crest Pro Health not as high in fluoride. ACT has the highest amount of fluoride that you can get without a prescription. Okay, so ACT mouth rinses, I'm a big, big, big fan of. Okay, lozenges, like I said, all the companies have so many different things. They have little gummies and lozenges and candies and sprays and rinses that you can use, so I'm just trying to show you these things. This is a newer one that a pediatric dentist colleague of mine, bless you, showed me, and this was taken in my bathroom because I went on Amazon and bought a couple bottles of it to try and use it, and I think it's awesome. So this is one that I actually prescribe. I don't prescribe it because you don't need a prescription. Inform a lot of our patients that we see at work that are undergoing head and neck radiation, cancer treatments, things like that, where they have extremely dry mouths and they get a lot of ulcers, okay, and a lot of sores in the mouth. And this product is called Prevention. I haven't been able to find a grocery store or a pharmacy where I can get it on the shelf. But the little Amazon drone drops it off on my porch. So I order it on Amazon, and like I said, it's over the counter. I haven't been able to find it on the shelf, but you can find it online if you need to. And I think it's phenomenal, and every patient that I've had try it thinks it's amazing. Okay, so it's my opinion only. I think it's a very good product. We can also prescribe you mouth rinses at the hospital, okay, or in your dental office. And what we can do is find out what we need to include in our mouthwash, and we can mix you up, or have the pharmacy mix you up something very, very specific to that individual patient. Okay, so if you have a little bit of a fungal infection, we can mix up something containing nystatin in a mouth rinse, and you swish and spit. Or if the fungal infection is a little bit further down in your esophagus, going into your stomach, then you can actually swallow it. Okay, so you can swish and then swallow it in small doses. Okay, so if you have a little bit of bacterial infection, we'll mix up a mouthwash, including an antibiotic. Okay, sometimes it's all of the above. Sometimes patients we see in the hospital will have a bacterial infection, a fungal infection, and big mouth sores. Okay, so we're going to mix up something with 3 or 4 different things, which I think is kind of neat that we're able to do that and help them out. Okay, so I thought this was kind of funny, especially with Halloween coming on here. All right, increased risk of periodontal disease and decay related to the dry mouth. Okay, so things we can do to help you out. We're going to monitor more closely, early intervention, so sometimes a little bit more aggressive or creative treatment planning, and sometimes patients' hygiene can be affected by manual dexterity. Okay, so sometimes patients have difficulty with their hands and fingers. Might not be real easy to wrap floss around your fingers. It can get to those back teeth. That's hard for most individuals in general, but especially if you have dexterity issues. Okay, so we can give you little tips and tricks to help you out with that, because that's a huge issue. Okay, so patient needs to be able to get back and clean those areas. We need to be able to get back and clean those areas. So sometimes we need to be a little bit creative in our treatment planning, and that's okay. That's part of our job. Okay. Fluoride varnish. I keep talking about fluoride because it's such an important part of what we can do to help fight cavities. So both medical and dental teams can actually apply fluoride to teeth. The difference between fluoride that we talked about in mouthwashes is that a fluoride varnish is more like a paste or a syrup. So I always describe it as a syrup. If you get like maple syrup on your hands, it's really sticky and kind of annoying. You just want to wash your hands right away. That's exactly what it feels like on your teeth. Okay, so it doesn't feel great, but it does a phenomenal job. And over time, an hour-ish, it'll start to wear off, but it's done its job. Okay, so sometimes we'll put that on patients, mostly our pediatric population, or people we know we might not be able to see on a real regular basis. We'll put some fluoride varnish on their teeth. Okay, so this is a great thing that a lot of different medical providers are able to do to help our patients out. Okay, we're on to a couple of the radiographic findings. Okay, so I'll be real quick here. Widening of the periodontal ligament. We're not sure what causes it. Okay, it's found on X-ray, and I'll try to explain on the next slide how it looks. But nothing you can really do, or nothing we can do as a provider to help you out. It's a radiographic finding over time. Sometimes it can lead to mobility of teeth. Okay, so teeth will start to move around, or you'll almost feel like they're a little bit loose. And how it looks on X-ray. So on a normal tooth, you have this cushion. So what your periodontal ligament is, it surrounds the root of the tooth that is in bone. Okay, so if you picture pulling a sock over your leg, say you have a long sock that's going to be up to your knee. So you're going to pull that sock over your leg up to your knee. It's really, really thin. It's going to provide a little bit of a cushion when you put your foot on the ground. Okay, I don't know if that's a good analogy or not. Maybe that makes no sense. If it does, I apologize. But the PDL, the periodontal ligament, surrounds the root of the tooth. It's very, very thin. So it's almost like pulling a sock over the root of the tooth. It's a shock absorber. It helps protect the tooth. And it's supposed to be real nice and tight to the tooth. Okay, when we're looking at x-rays, that's kind of a normal appearance. And if you compare it to here, you can see that's a little bit wider. Does that make sense? And so over time, if this develops on the same side, which it is starting to here, and we can see it here as well, instead of being nice and tight and locked into the bone, teeth can move around a little bit. Okay, so that's something that your dentist might point out to you on x-ray, or if they don't and you see that, then you can point it out to them. Tell them that you learned it at the patient education conference. This is a bigger scan, but just to show the same thing. Okay, widening of the periodontal ligament. We see it on a lot of teeth on this patient. Just again to kind of drive the point home there. Mandibular bone resorption, same thing related to fibrosis of the tissue. So where your muscles connect to bone, instead of again being nice and elastic over time, they turn more fibrous, and so it kind of wears away at the bone. So on an X-ray such as this, we would see it at the angle. We see it a lot of times at the angle of the mandible. Instead of being very distinct, it's more rounded due to the pull of that ligament and muscles where they attach. Okay, so again, nothing we can do to help that or prevent that. Just one of those things that we see it often, and it might be pointed out to you. Okay? GERD, we talked a little bit about that already, and things that we can do. So patients, physicians, dentists can monitor this and be aware of this, and work together to try and help the patient. So it was already mentioned earlier, but things we can do to help. So patient positioning when sleeping, medications, proton pump inhibitors, antacids, things like that, and diet. So we need some help from our nutritionists sometimes, okay, to help patients get on a diet that might be best for them, or at least talk about some foods that can maybe help decrease or hopefully eliminate things related to GERD. Okay, things we see in the mouth related to GERD, it wears away the teeth, okay, which is not a good thing. So we see surfaces of the teeth which are worn away because GERD is acid. Okay, we talked earlier about acid and what it can do to the teeth. So if you picture a tooth, it's made up of different layers. So if you picture a hard-boiled egg, I always use this comparison, hard-boiled egg would be like the tooth, and the outer layer is the white part of the hard-boiled egg. So that's your enamel layer of your tooth, the white shiny outer layer that protects the tooth and it looks nice. The inner layer of the tooth would be the yolk or the yellow part of the hard-boiled egg. So if you wear away that outer shell or outer layer and you get into the dentin layer, which is the middle layer, it's darker, doesn't look as nice, but it's also soft. Okay, so that outer enamel layer is a great protective layer of the tooth, and it also looks nicer. Okay, so if we wear it away because of acid, you can see, I hope, or I think, that these teeth almost looks a little bit yellowish or a little bit brown in color instead of nice and bright and white. And that's because the enamel layer has been worn away because of GERD. And on the molars, we see these little pits. And that's just from acid sitting in the pits of the molars and not being washed away, probably because of dry mouth. Okay, so we see these little pits in the molars, and you can see it's a little bit more brownish because that outer enamel layer has been worn away. Okay? Things that we can do to help you, frequent recalls. Okay, so getting you in more often. That's a very, very easy thing to do. It just takes effort on our part, on your part, and it takes a little bit of time and investment of time. And I think that's a relatively simple and easy thing to do. And I don't know why a lot of people do it. Everybody gets in the mindset of go see your dentist every 6 months. And everybody has that mindset where we see patients sometimes every 2 weeks. And our setting's a little bit different, where a lot of my patients are people that work in the hospital. It'll be like a big medical center like this. And so a lot of my patients are physicians and nurses and administrative people and security people and all these people that work here. So they can just stop by. A lot of them think that they don't need appointments and they can literally just walk in, which is kind of nice, but we can see people often, and we have that luxury because most of the people work in our big medical center. So, somebody who has something going on, whatever that might be, I say, yeah, pop in next week. Okay, or come in on Friday, I want to see you before the weekend. And they'll come in, it's very easy to do, instead of them being 30 minutes away, having to drive, park, blah, blah, blah. Okay, so frequent recalls, easy to do, sometimes easier to do depending on location and how how you work with your dentist, but I think that it's an absolute must. Okay. Progressive and creative treatment planning. We talked about that a little bit already. My job is to provide you with knowledgeable staff to keep you comfortable and to do the best work that we can do. Okay, so that might involve patient positioning. It might involve giving you a warm blanket as soon as you walk in, having different mouth props to help keep you open. Okay, if your muscles get very sore, whatever that might be, we have a whole laundry list of things that we can do to help make your experience better, and that's on us. Okay, so that's my job to let my front desk know, to let my assistants know, my hygienists know, the residents of the hospital that we're working with, but that's on us. Okay, and the ability to consult with our other experts. Okay, so that's our responsibility, my responsibility as your oral healthcare provider. If I see something that's a little bit weird going on, I need to get on the phone and call person A, B, and C. Okay, and find out how we can help you out. All right, communicate. 2018, we have phones, we have computers, we have all these different things. I'm not real great with technology, but I think that I'm very good with communication. Okay, so in my opinion only, I think if you don't communicate, it's either that you're lazy or you don't care. Okay, communication is very easy. Sometimes it's not easy to have conversations about certain topics or things that are going on, but I think it's an absolute must. So we have to be able to communicate to you as patients. You need to be able to communicate to us as providers. If there's any break in that link, we're in a tough spot. Okay, so what you can do to help your dentist, beating a dead horse here, but communicate and be honest. Tell us what your medications do to you, how they make you feel, things that they do to certain things in your mouth, specifically for myself. That way I know and I can try and help you out. Okay, so we got to fight the dry mouth and detail and consistency with oral hygiene practices and recalls. Okay, so again, that's on you as the patient to stick with those and to really buy in. And if we say, you know what, we really think it would benefit you to see you every 3 months instead of every 6, if I communicate to you why, and I tell you, if you were my mother or my father, this is what I would do for you, and you believe me, then let's do it. Okay, so that's on you to really, take the ball and do that as well. Okay, healthy lifestyle practices, a ton of those to do, and a few little extras that we'll talk about here. Okay, things a little bit outside the box, and I know it's getting close to lunch. I'll be super quick here in the last couple minutes. Flossing aids. All right, we talked about that. Sometimes it can be difficult, always, but especially if you have dexterity issues, wrapping the floss around your fingers, getting to those back areas. So we have these little things that look like slingshots, and they have a little thing of floss in between them. Okay, and then these little picks here are almost like a little pipe cleaner that you just kind of get the things out from between your teeth. So my little middle console of my car has like 15 packets of these. I just, while I'm sitting in Chicago traffic, I just pick at my teeth. So I think these things are awesome, and these are really great for getting to back areas and difficult areas as well. Okay, so help with toothbrushes. Okay, we can make the handles bigger. Okay, so you can hold it and grasp it a little bit easier, a little bit better. And nowadays we have electric toothbrushes. Okay, so the brush can do the work for you. Mouth rinses that are high in fluoride. So again, my little roll down the oral health care aisle of the pharmacy. Electric toothbrushes, they range from $30 to $130. Okay, I am given samples by all of these companies, and I wrap them up and give them away as gifts because I still use the $3 manual brush because that's what I like to do. So there is a place for electric toothbrushes. They do a really good job now. Some of them are programmed so that it beeps to tell you when it's time to like switch areas of your mouth. It gives you notification if you're pressing too hard and you're applying too much pressure to the teeth. It gives you a little notification. So they're pretty incredible, and they do have a purpose for people that have issues brushing their teeth correctly. You can let the brush do the work. Okay, so this is one that we have in our office. Our hygienists have them next to their computer on their little side desk, and patients ask for them sometimes, so there's a picture of that. Creative with the handle. Okay, so you can use anything and everything under the sun to make the handle bigger to help grasp. I played hockey my whole life, and so for some reason I have a roll of hockey tape in my office. And so we'll wrap up the handle with hockey tape. Just like you wrap up the handle of a hockey stick. You can use elastic bands, you can use foam, a tennis ball, you can use whatever you want. So be creative on making the handle bigger to help with dexterity. Okay. Implant dentistry, we have the ability to restore function and aesthetics. Those are the two things that patients are always interested in, and as providers that we want to be able to do for you. So like you be able to eat, speak, and chew from a functional standpoint and make it look good. Okay, so great long-term success. We're getting better every single year, just like a lot of different areas because of science and research. Okay, this article came out recently. It was a study about implant success or survival on patients with Hogan. So there's a little bit of back and forth as to whether you should place implants or should not. And basically the conclusion of the study was high implant survival rate, which is a good thing. Low bone loss around the implants, which is a good thing. So you want to have a lot of bone around the implant or around your teeth to hold it in place and keep it nice and sturdy. Okay, it's like putting a tree in the ground. And if you don't have anything around the tree, it's going to be loose and it's going to fall out. So you want to dig a deep enough hole, plant your tree, fill that in, make it nice and solid. Last thing is low biological complications, so low or no infection, irritation of the tissue, things like that. So all good things. The last thing is a highly, highly improved quality of life. Okay, so implants, it's very, very individual. Okay, so we can't sit here and say everybody's a candidate for implants or nobody's a candidate. It's on a case-by-case basis, obviously, just like everything else. But implants are a great option. And this is just a patient that we did some upper implants on. So this gentleman didn't have any teeth on his upper arch. He didn't like his full plate that he had because it was something that he had to take out every night and put on his bedside table, and it was loose and he couldn't eat certain foods. So we put implants in, made him something that he was happy with from a functional and cosmetic standpoint. He's able to smile and do things that he wants to do. So real quick, 2 more seconds, ways to improve maximal opening. Tongue depressors, you stack them. They're easy and they're cheap. Okay, tongue depressors are popsicle sticks. And so patients that have limited opening, you put your popsicle sticks in your mouth, you find a number, 15, 20, however many, put them in your mouth and increase the number of popsicle sticks as you're able to really stretch and keep them in for a couple minutes at a time. Okay, so it's almost from like a physical therapy type exercise to do. But tongue depressors are super easy and super cheap. Okay? Another option is the Therabite and Aura Stretch. Okay, so those are devices that you need a script for, you need parts, and sometimes insurance will cover it, sometimes they will not. And it's for the same purpose. Okay, so it has a little fork that you put in your mouth, and you press on this device, and the fork opens. Okay, to stretch the muscles of your jaw in your mouth. Okay, so Therabite on the left, Aura Stretch on the right. You get a little bag with all the little parts and pieces and things like that. They do a great job, but popsicle sticks do as well. Okay. Recap, a lot of different organ involvement and systemic manifestations, as a lot of people talked about. Common dental findings, dry mouth that can lead to cavities, fibrosis that can lead to limited opening. We talked about ways that I or we in the dental profession can help you. We talked about ways that you can help yourself and your dentist, and a few little tips and tricks. Okay, so thank you very much. I have my email on there if anybody has any questions or wants things on the slides, emailed to you. If that's easier to pull them up on your phone or your computer or whatever, just shoot me an email. Happy to help in any way that I can. I really, really appreciate you guys having me here. Thank you.
Thank you.
Yeah, I can take questions if you like, or I can stick around if everybody's stomach's grumbling and they want to get to lunch. Or I'm happy to answer a couple here, or both. If you want to answer here and some people want to go eat and get the best sandwiches, or then that's fine. So it's up to you. Say that again, I'm sorry. Water pick? Yeah, water pick. So the question was, how do I feel about the water pick? It's a device that kind of shoots out water, cleans out, used to clean out the teeth. It's very good. Yeah, it's a good, absolutely. Yeah, absolutely. So it's another thing that you can use, and it can get to difficult areas. And it's a very, very good thing, yes. I'm a big fan of water pick. Yes. Yes? Say the last part, sorry?
Your teeth are so close.
Yes.
It's really hard to get dental floss in there. Would the water pick be better, or would it be allowed to affect dental floss? Really close.
Yeah, so water pick can help. I like the soft picks, the ones I was joking about, but not joking about. I have in my car, and I clean out in between the teeth. So I think those are great if you have difficulty snapping floss through the contacts of your teeth. If your teeth are super tight and you have difficulty snapping the floss and getting down there, the soft picks, you go underneath the contact of the tooth. So you kind of go in between the teeth and kind of back and forth and clean them out. So those are very good. The water pick can help you with that as well. Yes?
You talked about lozenges for dry mouth, but what about sugar and lozenges? I mean, a lot of them seem to have sugar that I've seen.
Yes, so the ones that I showed are sugar-free.
Okay.
Yeah, and that's the biggest thing too. So a lot of people will suck on candies to stimulate your saliva and just to have in your mouth, or first of all because it tastes good, and second of all to try and stimulate saliva. The biggest thing is hopefully that you can choose sugar-free.
Okay.
Yes, so sugar-free lozenges, sugar-free gum. A lot of the gums are really, really high in sugar. Others have no sugar. And a lot of the gums now have something called xylitol, spelled with an X. And xylitol actually helps fight cavities as well, not to the extent of fluoride, but it does a pretty good job. So if you have gum that is sugar-free and it has xylitol, that gets me really excited. And you can find that when you check out at the grocery store, you have all these different ones. So Trident has one of the ones that has gum that's sugar-free and has xylitol. So that's like a win-win for everybody, and it tastes good. Yes?
What would the treatment be for when the gum pulls away from the tooth as it starts pulling away?
Yeah, so the question was, what is the treatment when the gums start to pull away from the tooth or recede? So we, like the dental term for that is recession of the gums, so it kind of drops down, or if it's the upper teeth, it drops up, making more of the tooth and the root exposed. So there's a couple different causes for that that we won't get into because it's too long, but a couple different causes. End result is the same, that you have recession. So it kind of depends how bad it is, what the causes are. If we can clean up the cause, then hopefully we can come up with a plan for it. So worst case scenario, we can take tissue from different parts of your mouth and do a surgery. That's worst case scenario, pretty extreme. Other times, the biggest complaint with recession is sensitivity. And so there are things we can do to help with sensitivity and hopefully keep your recession at a level that it's not getting worse, and we can kind of monitor to keep it there. If it continues to get worse, then sometimes we need to do the gum surgery, but that's pretty extreme.
Is there anything at home that a person can do to try to prevent it or lessen it?
Yeah, so the question was anything at home you can do to try and prevent it or decrease the recession or the rate of recession. So one of the three big causes of recession is manual trauma, okay, from brushing your teeth. Okay, so if you brush your teeth really hard with a brush that has bristles that are really hard, and you scrub like you're cleaning the kitchen counter, then you're going to wear away the gums. Okay, so very, very gentle brushing, excuse me, with bristles that are very, very soft. Okay, so that's one thing. Mechanical trauma or aggressive toothbrushing can wear away gums, so that's something you can do at home. Another thing that causes recession is if you grind your teeth. Okay, so if you're a tooth grinder, we can make you a mouth guard. okay, or a night guard that you can wear. A lot of people do it when they sleep or when they're in stressful situations. So some people put their night guard in, or their mouth guard, splint, when they're on the computer. If they're at work and they sometimes grind their teeth when they're sending an email to their boss, then you can pop your thing in if you don't have to speak, because when you speak, you kind of brush it away. So those are two things that you can do at home to help gentle brushing away from the gums. And if you are a grinder, your dentist can make you a splint, and you can wear that at night or whenever you grind your teeth. Those are a couple of things that can help you at home.
With that in mind, is like the electric toothbrush not a good idea?
So the question was, with that in mind, is the electric toothbrush not a good idea? No, if you use it properly. Yeah, so if you use it properly, you can do some damage with the electric toothbrush, even if it's buzzing and going crazy because you're applying too much pressure. You can not listen to it and keep scrubbing. So the electric toothbrush is almost a little reminder. It's pressure sensitive, so it will tell you if you're pushing too hard from what they think. My opinion is your dentist or hygienist should spend an extra couple minutes with you and teach you how to brush properly and how to hold the brush. And then we can give you a manual brush and you can do it on your own.